Assalamualaikum warahmatullahi wabarakatuh, and good morning, everyone. I'm Intan from Anatomy. Today, I'd like to introduce an esteemed colleague of mine from the department, Dr. Snehlata Samberkar. She's originally from Mumbai, India, but have been serving UM for the past 15 years. With more than 20 years of experience as anatomy educator, let's welcome Dr. Snehlata to present her talk titled The Evolution of Anatomy Teaching and Learning.
Thank you, Dr. Intan, for kind introduction. I will share my slides now. Okay, good morning, everyone. I'm Dr. Snehlata Samberkar, and today I'm going to share some valuable insight on evolution of anatomy, teaching, and learning. Now, anatomy is a fundamental subject in the field of medicine, biology, and health sciences, providing essential knowledge about how the body is constructed and function. So the study of structure of human body is called as anatomy. Now, here are the key areas of anatomy. Like the study of macroscopic anatomy is called as gross anatomy. Study of microscopic anatomy is called as histology. Study of development of an organism from fertilization to birth is called as embryology. Study of external features of the body is called as surface anatomy. And the practical application of anatomical knowledge to diagnosis and treatment is called as clinical anatomy. Now, there are 4 senses involved in anatomy, teaching, and learning. The first one is hearing. Now, hearing is essential for understanding lectures, verbal explanation, and discussion led by instructors. Then come visions. Now, students can observe the anatomical structures and gain better understanding of anatomical relationship and complexity. Then come cognitive function. Now, students can understand the relationship between the structures and apply the knowledge of anatomy in clinical setting. It also involves critical thinking and problem solving. It can also integrate the knowledge of anatomy with other medical fields like pathology, physiology to understand the human body. And finally is the motor skill. So developing fine motor skill is crucial for performing anatomy dissection. Now, traditionally, dissection was a standard method in anatomy education. Students used to dissect human cadavers under the guidance of experienced anatomists. But now we face challenges with cadaveric dissection. As it is difficult to obtain cadavers, there are very few donors. There is cost effective in maintaining the cadavers. Then formalin and other chemicals used in preserving cadavers pose a health risk to students and lecturers. And although rare, still there is a potential risk of infection from cadaveric tissue. So we use additional dry medium like models, jars, plastinated specimen, and prosected specimen. Now the pandemic presented various challenges for in-person learning. To support student education during this time, University Malaya introduced an online platform called Lecturio. This online platform is free for UM staff and students. Now, Lecturio platform is designed to support medical education and training. It provides a comprehensive range of resources, including high-quality pre-recorded lectures, videos, interactive quizzes, and study material. Now, here is a short video demonstrating how this platform is used for anatomy, teaching, and learning.
In this lecture, we'll look at the joints of the upper limb. So first of all, we'll start with the sternoclavicular joint and the acromioclavicular joint, followed by the glenohumeral joint, the elbow joint, the proximal radio-ulnar joint, the distal radio-ulnar joint, and then we'll look at various joints within the wrist, the carpal bones, the carpo-metacarpal joints, important joints within the hand, and then finally the metacarpophalangeal joints and the interphalangeal joints. So let's take a tour through the joints of the upper limb. Let's start with the sternoclavicular joint. It's really associated, as its name suggests, as all of the names of the joints suggest, between the sternum, but this time the proximal end of the clavicle is articulating with the sternum at its clavicular notch, specifically of the manubrium of the sternum. So the proximal end of the clavicle attaching to the manubrium of the sternum. There's also a slight interaction with the first costal cartilage, and here we can see the articular cavity between those two, which is occupied by an articular disc. Here we can see it's covered, as many of the joints are, by a joint capsule, and here we can see strengthening of that joint capsule by various ligaments. Here we have the anterior. We'll find we also have a posterior version. So the anterior and posterior sternoclavicular ligaments. Here we can see running from this joint all the way across the superior surface of the manubrium to the other sternoclavicular joint, we have the interclavicular ligament. Attaching the clavicle and holding it in place against the first rib, we have the costoclavicular ligament as well. If we then move on to the movement of the sternoclavicular joint, there's not that much mobility in this space. There's a little bit of elevation and a little bit of depression. Here we can see this looking at the anterior aspect. And then if we have a look superiorly down onto the superior surface of the manubrium on the right and the clavicle extending towards the left, we can have protraction with the clavicle moving anteriorly, and we can have retraction with the clavicle moving posteriorly. There's also minimal rotation axially around the axial aspect of the clavicle. It can rotate very slightly.
We also use game-based learning platform called as Kahoot. Now, Kahoot is an interactive and competitive format which increases student engagement and motivation. Now, lecturers create customized quizzes tailored to the specific learning objective of anatomy topics, and at the end of our lecture, we ask the student to log in into the system and answer the quizzes. Now, this platform promotes active participation as students answer questions in real time and also receive instant feedback on their answers. So here is a short video demonstrating how Kahoot is used in anatomy education. Now, advances in technology run hand in hand with education system. There is an advanced educational tool primarily used for anatomy education called as virtual dissection table. Now, a virtual dissection table is a large interactive touchscreen device resembling a big flat table. It showcases detailed 3D images of the human body that can be rotated, zoomed in, and dissected digitally. Now, here is a short video demonstrating how this dissection table is used for anatomy teaching and learning.
Now, 2 fingers, hold it around. 1 finger rotates it. Okay. We do anatomy very heavily in the second year. So the second year is really when the anatomage table comes into play. We can see all the different systems on the anatomage table. We can see muscle systems that you couldn't see on a model because you can only see superficial muscles on a model, but you can go all the way through all the muscles on the table. But this is also something, this technology is something that most students would not see until they got to medical school, if they even see it then. See the kidneys in here? Right. You've got the kidneys. There's the bladder. You've got the kidneys. So we get to work like inside the body as well. We get to see the different parts, like the muscles and the nervous system. Okay, get over here. That's cool. Yeah. Wow.
Now, for more comprehensive understanding of anatomy, there is also an app called as Complete Anatomy app. It is an advanced educational tool designed for medical and health science students. You can download this app by using App Store or Google Play. There is a subscription fee for students and professionals. Now, here is a short video demonstrating how Complete Anatomy app is used for anatomy.
Welcome to Complete Anatomy. We're so excited for you to join our global community of anatomists transforming their learning through the world's most advanced anatomy education platform. Complete Anatomy brings together the very best models, content, technology, and tools in one place. So whether you're an anatomy pro or just getting started, you're on the right track to learning more effectively. So let's get started. Jump straight to models from your hub to start interacting. You can rotate, zoom, and select from the 3D human. Using the Systems menu, the breadcrumb trail, the Models menu, and View controls, you'll be navigating the model in no time. Press and hold the model's icon to quickly switch model sex. Register for free to unlock 3 days full access to the platform, where you can interact with movement, dive down to microscopic level, and check out the groundbreaking beating heart. Use the patent-pending tools to dissect the model and jump into AR mode to simulate a cadaveric lab. Use a library of radiological images to compare with cross-sections in the 3D model. Choose from MRI, CT scans, angiograms, and more, and deepen your understanding of the image structures in 3D space. The structure-specific features allow you to discover even more under the hood. Map the origin and insertion points of muscles, trace the origin path of a nerve, visualize the parts, surfaces, and landmarks of bones, and lots more. Created something really cool? Save it to your library with the Save Screen button for future reference. Explore over 1,000 detailed videos and over 100 interactive lectures in the library to deepen your knowledge of anatomy, orthopedics, physiology, ophthalmology, cardiology, dentistry, ultrasound, and clinical studies. Find the detailed video tutorials for each feature by selecting the Tips button at the bottom of the main menu. When you're ready to take the next step, visit the store to see what's on offer. Thanks for watching and enjoy Complete Anatomy. Welcome to Complete.
Now, we also have Pirago Interactive Anatomy. Now, this is created on a 3-dimensional platform with a realistic human body visualization system. It contains pathological organs and radiological images. So the software allows the comparison between pathological and normal organs, including histology. It also compares the CT scan and MRI with the normal anatomical structure. Here is a short video demonstrating how the app is used for anatomy education. Then comes augmented reality. Now, augmented reality apps and devices can project three-dimensional anatomical models onto the physical space, allowing students to see and study these models as if they are part of the real environment. Now, here is a short video demonstrating how augmented reality is used for anatomy
Augmented
education.
reality is available on certain mobile devices. Navigate to the Quizzes section and select Lab Activities. Access the website to select and print the desired activity. In the app, launch the view listed on the activity sheet. Select Augmented Reality mode. Scan the image on the sheet until an arrow appears. Tap the arrow and the 3D model appears in Augmented Reality mode. As you work to complete the activity, use these finger gestures to adjust or interact with the model. Drag 2 fingers on the screen to reposition. Use 1 finger to rotate. Pinch open or closed to scale. Select a structure to access additional information and features. To move on to another activity, simply scan the image on the next worksheet.
Then comes virtual reality. Now, virtual reality is an immersive technology to create a simulated three-dimensional environment where the students can explore and interact with detailed anatomical model. This technology uses VR headsets, gloves, and other devices to provide a fully immersive experience that enhances the learning and understanding of human anatomy. The students can manipulate anatomical structures, zoom in on specific areas, dissect layers to see the inside organs and tissue. Now, here is a short video demonstrating how virtual reality is used in
Here at UCSF, we're introducing virtual reality for the first-year medical students that corresponds with their first learning block. So when they leave the cadaveric lab, they can immediately come over to the virtual reality lab and they can learn the same material they just saw on the cadaver in a virtual space. In virtual reality, they can go from the skin level all the way down to the bones and take every single layer off as they go, see the relationships, how they're stacked up, how they're aligned. And then when they get to the bones, they can repeat it almost like a puzzle and put all the pieces right back on there, all the way back out to the skin.
Today, I spent 3 hours in the anatomy lab, and then I went straight from that to working on the virtual reality anatomy lab, essentially, where I was able to sort of pull the muscles apart that I had been looking at on the cadavers. I think the cadaver experience is really, integral to our medical education. And, Derek and the whole staff does an amazing job of instructing us and taking us through the cadavers and being able to see those muscles on those bodies. But at the same time, it's a little bit difficult to get an entire three-dimensional picture of what's going on. With the VR, it's sort of like a process, where you can build it and rebuild it. And I think that sort of helps understand the anatomy a lot better and a much more in-depth experience.
One of the hardest things for students in anatomy, at least early on, is understanding that spatial relationship of everything in the body. Virtual reality is exciting for me as an anatomy instructor because it's going to be able to enhance the student's understanding of the arrangement of the body. Because the better they know the body, the better physicians they'll end up being the rest of their career.
Then comes 3D printing. Now, 3D printing refers to the use of 3D printing technology to create accurate, tangible models of human anatomical structures. These models are used as educational tool to help students and professionals to understand the complexity of human anatomy. We have 3 steps in 3D printing. First is uploading your STL file. Second is your file will be checked for quality printing. And third is you visualize the anatomical model. So now in future, we will have virtual teaching assistant by AI. Now this AI can deliver the pre-recorded lectures, tutorials, and demonstration. It can provide additional resources such as reading material, videos, and interactive modules to complement the main curriculum. It can also customize the learning path based on individual students' strength, weakness, and learning speed, ensuring a more tailored educational experience. And it can also provide personalized tutoring and answering questions in real time, helping students with difficult concepts and problems. So a new platform called Umbos and Osmosis was recently released as a free trial for staff and students. It caters for both clinical and preclinical discipline. Consider registering for a free trial using your university account. Now, the Department of Anatomy has a body donation program. More information can be obtained from the contact details displayed on the screen. So in conclusion, teaching and learning in anatomy has evolved from cadaveric dissection to the virtual teaching assistant. While we appreciate the traditional teaching technique, we also realize the need to integrate future technologies into the learning process. At University Malaya, we will continue to maintain this balance as we improve our teaching and learning approach. With that, thank you so much.
Thank you, Dr. Snehlata. There's a lot of educational apps that you presented just now. We have one question from the participants. As a clinical teacher, we find students who teachers find it difficult to recall the anatomy of the body that matters. So clinically related anatomy. Maybe we should have feedbacks from clinicians to look for areas to improve. Your thoughts, please.
Now we have got all these online teaching tools and digital technology. They all are designed to complement our main teaching methods. So it is the responsibility of the students to revise all these basic, the medical syllabus, either online or through dissection, before they go for clinical settings. So learning is a continuous process, and they need to revise the topic before they go for clinical postings. So we as lecturers, we should encourage the students to go through anatomy, to revise the topics, and discuss the topics with your colleagues in clinical settings.
The question also mentioned that should we have feedbacks from clinician to look on how to improve the anatomy?
We can have feedback from clinician.
Thank you very much. There's no other answer from the participants. Thank you for the talk, Dr. Sneha. I think that's it for this week breakfast at UMHealth. Thank you everyone for listening in.
Thank you so much.